Bhavsar madam, please start the session.
Okay, sir. A very good morning to all. Honorable Speaker, Dr. Praveen Kumar Vishwanath Ingle, sir. Respected Principal, Dr. G.S. Talele, sir. Dr. Prashant Malpure, sir. Mr. Sachin Kapse, sir. HOD, MCOP. Mr. Prashant Vyavhare, sir. All the staff members and all our invited valued participants. As you all are aware about that today, Matushri College of Pharmacy has arranged this international webinar on the topic patient safety in healthcare setting. So I, Shraddha Bhavsar, Assistant Professor, MCOP, on the behalf of Matushri College of Pharmacy, welcomes you all in this webinar. Before starting the session, I request our Principal Sir for giving a welcome note. Please, sir.
Good morning, one and all. On the behalf of the Matoshri College of Pharmacy, I hereby welcome all the participants in this informative webinar on the ensuring patient safety in healthcare setting. The Matoshri College of Pharmacy is coming up with the series of the webinars, and this is the second webinar in order to give a tonic of the knowledge to all of you in this COVID-19 situations. Today's guest of honor or today's speaker is Dr. Praveen Kumar Ingle. He is working as a senior lecturer at School of Pharmacy, International Medical University, Malaysia. On the behalf of the Matoshri College of Pharmacy, I heartily welcome Dr. Praveen Kumar Ingle for this session.
Thank you, sir.
Thank you. I am damn sure that this webinar will be helpful to all of you to uplift your knowledge about the patient safety and aware you all of about how to handle the patients as your pharmacist knowledge. Thank you very much for joining this webinar. Okay, thank you. Over to Bhavsar, madam.
Thank you, sir. Now, I will like to introduce our today's eminent speaker, Dr. Praveen Kumar Ingle, sir, to all of you. Sir is working as senior lecturer since July 24th, 2014 in Department of Pharmacy Practice, School of Pharmacy, Indian Medical University, Kuala Lumpur, Malaysia. He also serves as an editor-in-chief of Journal of Pharmaceutical Research and Clinical Practice. He is also founder member and president of Hari Vishwa Education Society. He worked as assistant professor in R.C. Patel Institute of Pharmaceutical Education and Research, Shirpur, Maharashtra. He has completed his master's in pharmacy practice from Dr. MGR Medical University, Periyar College of Pharmaceutical Sciences, Tamil Nadu, India. He has completed his PhD from National Maharashtra University, Jalgaon, Maharashtra. He has 14 years experience as teaching and 10 years as editor-in-chief. He has published more than 50 papers in national and international journals of repute. He secured research grant of Ringgit Malaysia more than 1 lakhs for UG and PG research projects from Indian Medical University. Apart from teaching and administration, he is also involved in developing teaching tools and coordinating academic sessions like objective structured clinical examination, professional skill development, computer-aided learning, and many more. He is life member of APTI and Indian Hospital Pharmacist Association. He is Indian Medical University Care Home Leader for Handicapped and Disabled Children Community Home. So this was a short introduction about the sir. With this, I request English sir to please continue the session. Please, sir.
Yeah, thank you so much, Talile sir and Bhavsar madam for giving my introduction. Okay, so yeah, I will start my session. Okay, before that, just a minute. Okay, can you please give me the host authority? Yeah, thank you. Vivare sir, can you please give me the host authority now so that I can start the session? Vivare sir, am I audible to you? Yeah, am I audible to you? Vivare sir, can you please give me the host authority so that I can share my screen? Okay, just I'm requesting to all the participants, the students, staff, can you please mute on your mic so that I will not get disturbed in between. Can you please switch off your mic? Okay, I think it's okay now. Okay. Yeah, so we can start with the session now. Okay, thank you all of you, and thank you Talale sir and Bhausar madam for giving my introduction. Okay, so just make sure we make sure that everything is okay. Now I'm going to start my session. Okay, so our today's topic is ensuring patient health in healthcare setting. Okay, before starting the session, good morning, everyone, and hope you all are doing well in this pandemic situation. Okay. At the outset, I would like to thanks to all management team members of Matoshri Education Society Nashik, and also special thanks to my guide, my mentor, Dr. G.S. Talele sir, for inviting me as a resource person and organizing this international webinar for faculty and students, and also some of you watching online in the YouTube, right? So also I want to thanks to coordinator of today's international webinar, that is Bhausar madam and Vavare sir, for having these efforts, and also they're all team members of Matoshri College of Pharmacy for all your efforts to make success of this program. And at last but not least, dear pharmacy student and all online viewers. So coming to the today's topic, I tailored the content of presentation. So patient safety is a basically is a the broad topic. So we cannot cover everything in the 1 hour time period. So I tried to tailor the content, and that will fulfill your the requirement. Like I gone through the Pune University syllabus, and I saw that some of the components are related to the clinical setting, the clinical relevance. So just I want to focus on that particular points here in this today's our international webinar. Okay, so some of the point I added here in regards with our Indian setup, okay, the Indian hospital setup, and also what particular we have the healthcare setting in India. Okay, so I tailored the content accordingly. Okay, in this presentation I given a brief idea about the patient safety. So each and every component is not I cannot add everything regarding the patient safety. Okay, so mainly focus is our pharmacy and other healthcare professional also they can learn from it, but the main focus will be on pharmacy and how they can deal with the patient in this pandemic situation. So wherever possible I try to quote some examples regarding this patient safety, because as like the patient safety is a very dry area, so you cannot uh, communicate with the student without giving the example. So whatever we have the our experience from our past, so that we need to quote here, and that is how we can engage the audience. Okay, so I will try to explain and give some example in between. Okay, so this topic is I told you, like it's not only related with the pharmaceutical education, but other healthcare professional they can also learn something from this. Okay, so that is my aim of today's presentation. Okay, and this presentation is only for educational purpose and not for commercial use. Okay, so I will start with the presentation. So here you can see in the first slide, the title, Ensuring Patient Safety in Healthcare Setting. Okay, so there are many healthcare setting. It's not only related with the hospital or only the clinic or the the specialist clinic. So there are many healthcare settings are there. So if you are comparing with the other Western countries, we have some limitation in the healthcare setting. We are not having that many, but I will tell you what are those particular important one we have in our Indian scenario, in Indian setup. Okay, so you can see here, this is the World Patient Safety Day. So this was the first World Patient Safety Day. Why I given here this particular World Patient Safety Day? So because this was the first, they started the WHO, the World Health Organization, they started the patient safety, and they also had some agenda for the patient safety. So they started on 17 September 2019 in last year. Okay, and now we'll move to the our presentation. So these are the key components I want to highlight here regarding the patient safety. The first one is background. So background is important, like if you're reading some articles, recent articles regarding the patient safety, so the background is very important. And why the WHO came with this latest patient safety issue last year? So last year they started this the having the circulation of the pamphlets, or having the leaflet circulation, and then aware the people about the patient safety, all the healthcare professionals, all the healthcare educators, all the patient, those are related with the this particular medication, or those are having any disease condition. So that's why the background is very important. And again, in our Indian setup, what particular type of system we have for reporting adverse drug reaction. And also you might be heard about pharmacovigilance. So as I gone through your curriculum, so already in PCI, the Pharmacy Council of India, and then some of the university, they already mentioned some of the key points of the clinical aspect, like pharmacovigilance, how to report the ADR, who can report the ADR. So these all the basic things. I hope so you know that all the relevant things. Again, after the background, there is an introduction. So we'll see in this what is the patient safety, and then the points related to the patient safety, like patient safety concern, common misunderstanding about patient safety, international patient safety goals, and ensuring patient safety in healthcare setting. And lastly, what message I want to deliver to all of you. So just going back and just reflecting what I did in this pandemic situation. So I participated in some of the international webinar, and then this is the one I delivered last week, I think, yeah, on Wednesday. Yeah. So importance of self-reflection in development. So what you can do, you can just use this QR code and you can see my YouTube video later on. So this is also important in relation with the patient safety to those all healthcare providers, student, those are going to be pharma professionals in coming time, and also those teachers, those are teaching to the student in the classroom. So this is very important to learn something from it. So just I advise you to just visit on the YouTube, and then you can see this YouTube video. So I believe that it will be helpful for all of you in some sort. Okay. So coming to the background. So what is the background? So as I told you earlier, WHO, they started patient safety. So you can see here left hand side, speak up for patient safety. So no one should be harmed in healthcare. So this is the theme they have prepared, and then they communicated to all healthcare professionals, to all the student, to the all faculty members, to those or working in many organizations. So on the first ever the World Patient Safety Day was celebrated on 17 September 2019. So WHO launched a global campaign to create awareness of patient safety and urge people to show their commitment to make healthcare safer. So that is the commitment that they want from all the healthcare professionals. So that is the initiative I took, and then I'm presenting this topic to all of you. Okay, so that is the initiation from my side. So here at the bottom you can see WHO, World Health Organization, the patient safety, a global health priority, and speak up for patient safety. So everybody should speak for the patient safety wherever you are, like in the any world, in the any country in the world. So you need to be more aware about the patient safety. As you're a pharmacist, I will come to that example in my next slide. So here you can see the patient safety, and there are many parameters, many components, any elements. Those are important for the patient safety. Okay, so it's like error. You might be heard about the medication error. So how the errors will occur, right? So you know the look alike and sound alike effect, and because of that, how the medication errors may occur. So every individual, they may did the mistakes, they may have the errors while prescribing, while dispensing the medication, or any other setup. So in that way, we need to have the particular patient safety in that aspect. Okay, so what is the status of patient safety and pharmacovigilance in Indian scenario? So first of all, I want to discuss here, what do you mean by patient safety versus pharmacovigilance? I believe like many of you may know about pharmacovigilance. Pharmacovigilance, in a short way, how I can explain, is the prevention of adverse drug event or maybe side effect from the given medication. So this is the the unit of patient safety. So patient safety is an umbrella term, is a broad aspect, and under the patient safety, many parameters are coming. One of the parameter is pharmacovigilance. So obviously, if we have the patient safety, we are fulfilling the pharmacovigilance. So now, what do you mean by patient safety? So in the next slide, we'll see in detail the definition of patient safety. So before going for the patient safety in detail, I want to highlight some of the background information, and that will be helpful to have the insight of all the topic. Okay. So patient safety is also covering the errors, that you should not harm the patient. So that particular words are very important here. HARM, harm, and should not have the error or minimize the chances of error, because of that may lead to the complications in the patient. So as you know about thalidomide tragedy, right? 1960, I believe 1960, the thalidomide tragedy occurred, and many, those pregnant lady took this thalidomide had the problem of the phocomelia, right? So because of having the phocomelia, there is abnormality in the child, and there is abnormality in the limb abnormality, the phocomelia, right? So this thalidomide tragedy. So that thalidomide tragedy given a lesson to us that you should have the proper patient safety whenever you are giving the medication to all the patients, to any patient. Okay, so that's why I want to tell you about the thalidomide tragedy. Coming to the next point is a PCI, Pharmacy Council of India. They also have their curriculum, and then I know that in the UG level also, in the PG level also, and in the PharmD, they covered some of the aspect of the clinical side, like management of adverse drug reaction, how to report it, how to manage it, how to prevent it. So there are many components I've gone through in the curriculum, and still we need to add some of the aspect of patient safety in that, right? So patient safety is a broad term, as I explained to you earlier, right? So patient safety mainly includes pharmacovigilance also, but currently what we are going through is the pharmacovigilance. In that, how we can modify it, so we can add on clinical case scenario, so that will be helpful for all the students to develop their critical thinking, also to develop their application based knowledge. So whatever the things you are learning in your classroom, so you need to apply that. Most of the time what we will do, just we will listen to the lecturer in the classroom, but that time we won't have the interaction. So that is the way how you can develop your critical thinking, and also you can develop your the clinical aspect in that way. Okay, so case problem or the case based learning assessment. Okay, so this particularly related with the case based learning or the problem based learning, and also assessment, how we are going to do the assessment in that way. So problem means just you can use some problem of the clinical origin and then try to get the answer from the student. So we need to develop that particular habit in the patient. So I think some of you having the rights, and then I can see the changes in my slide. Vevare sir, can you please, just a minute, hold on. Am I audible to you, Vevare sir? Okay, so participants, please don't have any edit in my presentation while I'm presenting. It will disturb me. Okay, so I expect that thing from you as a professional, pharma professional. Okay, so be a professional. So who reports ADR? So particularly those are at healthcare professional, those are healthcare educator, they can report ADR. Even patient can report ADR. So there is a system in India. So they developed the app also. The app is called as ADR PVPI. So here you can see the ADR PVPI app. Okay, this is, I think, available in the Google App Store. Okay, so you can report that particular ADR, adverse drug reaction or event or side effect, to the higher authority, that is the NCC, National Coordinating Committee. So that is AIMS Delhi. Okay, and then CDSCO. So just will stop here because I think somebody is having the right authority to edit this content. So just a minute, hold on. So I will check the okay, now we'll see. Okay, so in India particularly, there are many ADRs, that is the adverse drug reaction monitoring centers. It's greater than 250. So those like MCI, the Medical Council of India, they approved the ADR, that is adverse drug reaction monitoring centers. So it's greater than 250 in India. Some zonal offices are also there, like 6 zonal offices in India, and 1 NCC, that is National Coordinating Center in AIMS, and that they are having the app so that you can submit the adverse drug reaction report to them. And then another one is CDSCO, Central Drug Standard Control Organization in Delhi, and that all the ADR reports, particularly that will go to the CDSCO, the New Delhi office. Okay, Standard Control, the Central Drugs Control Office in New Delhi, and afterwards it will reach to World Health Organization, that is Uppsala Monitoring Center, that is in Sweden. Okay, so every particular country, they report to WHO, World Health Organization, that is Uppsala Monitoring Center. And here, why I highlighted the warfarin issue here. So because as you know that warfarin is a drug having interaction with many other medications. So if you are going through the literature, there are many, more than 500 drugs, medications, those are having the problems with this warfarin. So interaction is there. So that might be the severe, moderate, or minor type of interaction. So while giving the warfarin, we need to give a proper instruction to the patient. So because this drug may cause bleeding in many of the patient if they are not using it correctly. So that is the patient safety concern. So if you are not communicating properly with the patient, that may lead to the consequences, that may lead to the bleeding. Okay, so now coming with the patient safety definition. So what is the meaning of patient safety? So patient safety involves limiting the harm, avoiding the errors, and reducing the mistakes. So how you can do all these things, limiting the harms and avoiding the errors, and reducing the mistakes. So for that, you need a planning, you need a communication amongst the healthcare professional, that includes doctors, pharmacists, nurse, and all other the support staff in the hospital. And that mainly leads with the lower infection rate and also reduces the errors. So that about, we talk about the medication error, right? So share same goal by the patient and healthcare providers and the support staff. So if you know your goal, that goal might be achieving and giving the possible treatment, the good treatment for the patient. So particularly you will have the same goal, that is patient, healthcare providers, and the support staff. So by that way you can give a possible treatment outcome. So the patient recovery will be in the early time without taking much time. Okay, so that is the meaning of patient safety here. So you can see here, limiting the harm and avoiding the errors. So that partially it will covers the pharmacovigilance here. So this is a broad topic, patient safety, and it covers many aspects, right from the building of the hospital to the discharge of the patient, and in between how you are monitoring the patient in the hospital. So many things are there, and how you are communicating with your vendors, the third party, those are relating with your hospital. So that includes not only the patient safety, but patient safety aspect with all other aspects. So because all other aspects, they may also have the problem with the patient safety point. So we need to care of all the components, then only we can deliver a patient safety. So that is the point here in the definition. So how errors occur? So how the errors occur? So lack of standard procedure for storage of medications that look alike and poor communications, lack of verification, and lack of involvement of patient in own care. So these are the things that mainly leads with the error in the patient. So poor communication is the most important. So because of having the non-communication, there is no proper communication, the many errors may come in a clinical setting, in the hospital setting. So how patient harm occur? Again, patient safety, healthcare discipline that mainly emerge. So if you are thinking about from the conventional way to your modern age, to the modern era, so our healthcare system is also evolved and having the many complexity in the healthcare system, and that is the case why we have the many harm to the patient. So we have the data from the WHO that I'm going to explain you later. So how the patient getting harm due to the many medicines, or the using different types of diagnostic tool, or maybe in treatment. So patient safety example. So how we can have a good patient safety. So use of appropriate antibiotic in prophylaxis in surgical patients to prevent the post operative infection. So if, say, suppose some patient having the surgery, so after the surgery there will be a specific antibiotic, otherwise that may lead to the certain complications that may have the sepsis. So using and choosing a correct appropriate antibiotic, that is a very important factor here, in case of patient safety. Use medicine safely. So again, in concern with the patient, they should take medicine properly, not in overdose. Sometimes the patient, they don't know about their medicine, they don't know about the consequences, and then that may lead with the some adverse event, and that adverse event might lead to the death even in some scenario. There are many scenarios that are available in internet. I don't want to specifically mention, I don't want to reveal any identity, so just I will give you the example later on. So what are the key points in patient safety as per World Health Organization 2019? So this occurrence of adverse event that is because of unsafe care. So in all over, one of the 10 leading cause of death and disability in the world. So if you're comparing the top 10, so it is one of the top 10 leading cause death of disability in the world. So that is the severity you can see here about the patient safety, and how many they are getting the harm because of the different treatment. It's not given proper treatment. So receiving hospital care in high income countries. So even though if you're thinking about the high income countries, the Western countries, 1 in every 10 patient is harmed due to the medication error or any other clinical aspect. So harm is caused due to range of adverse events. So nearly 50% of them are preventable. And how we are going to prevent it? To have the proper communication and to have the proper components of patient safety in that particular organization. Again, coming to the data, 134 million adverse events occur in hospital in low and middle income countries each year due to the unsafe care, and that leads to 2.6 million deaths around the world. So around 2/3 adverse events are unsafe care. So because of unsafe care, these all 2/3 adverse events are occurring worldwide. And globally, 4 in 10 patients harm due to the primary and outpatient health care. So those are getting the primary and outpatient health care. So out of 10, 4 are getting this problem. And in that, 80% of harm is preventable if you are taking a proper precaution or the prevention in concern with the patient safety. Most errors are detrimental, so that mainly relates with the diagnosis, prescription, and use of medicine. So these are the 3 particular the points: the diagnosis, prescription, and use of medicine. So these are the 3 major category why there is a patient safety issue will occur worldwide. So investments, so reducing the patient harm, that will also save the money of the people as well as the organization. So that's why it will also reduce the financial burden for the patient due to this adverse event. So what are the types of healthcare facility that are available in particularly Indian setups? So it's not only about the hospital, but there are many healthcare facility available like hospitals, clinic and medical office, and then blood bank, birth centers, imaging and radiology centers. So I think everyone knows all these terminology, right? So no need to explain in detail. Orthopedic and other rehabilitation centers, mainly especially with the bone and the fracture and the accident and the other things related with the orthopedic, right? So there are many now, many clinics are emerging or centers are emerging with the diabetes specialty. So because if you are looking at the patient they are growing day by day in diabetes sector. So that's why there are many, upcoming hospitals related with this diabetes education center. So what particular they are doing is educating the people in diabetes and also giving a proper treatment. Again, next to that is a dialysis center, mental health addiction treatment center. So these are the main, aspects or main types of healthcare facility that available in the India. So it's not like others are not that important, but just I, given some of the healthcare facility. There are many other healthcare facilities also available in Indian setup. Okay, so I just mentioned few of them. Again, coming for the introduction. So as a pharmacist, what is our role in community? So just ask question yourself. So just I want to, brainstorm you before starting my session. So as you are a pharmacist, you're learning in a pharmacy school in college. So as a pharmacist, what is our role in community? So might be some of you taken some initiative in this COVID-19 pandemic situation, but some may not. So as a pharmacist, it's your duty to, have the awareness about the disease condition. So that is your role in community. But, some of the pharmacists, we are not doing it. So, as you are having a community, so try to give that particular knowledge relevant to the society. Those they particularly need that, because even some people, they don't know, hand washing, regular hand washing and the benefits of that. So because lack of awareness, lack of education. So in that you can, in a society you can work, in a community you can work, and as a pharmacist you can, state your role there. So that is the initiative, the self initiative that comes from you. Again, coming to the, self initiative, look at your own and see how many, some of you may have some, some patients in your home itself. Try to check their medicine. Try to, counsel them. This medication is for what is the mechanism, or how the drug is acting. So to try to explain to the patient. So patient might be your, father, mother, or, might be your own son, or, the daughter. So try to explain to them. So why you're taking this medicine? What will happen if there is any side effect? What will happen if there is adverse effect? How to overcome on it? Okay, when to contact with the physician? So brainstorm it, and then, you self-reflect what you did up to this time, and then try to modify it, try to go to the next level, and, try to implement your knowledge, what knowledge you, got in your particular learning process in your classroom. So try to implement that. So if you are implementing that particular knowledge in your real practice, so that will be, the real advantage of your pharmacy profession. So try to do that, all the things. So if you are explaining to the patient, know your medicine, so that comes under know your medicine. So if you are explaining to the patient how to take medicine, and, so he will be happy. The patient will be more happy if you are explaining to them. So he will get some extra knowledge. So for example, some patient, they don't know even how much, the insulin dose they should take. So it's depend. If you are telling them in a proper way how to take, how to inject, and, what is the procedure to circulate the insulin injection over the body, why you should not take at the one point of time. So, these are the basic things. The storage of the insulin. You cannot keep, insulin as such in the sunlight, in the window shelf. So it should be stored in a proper way. So these are the, the self initiative that should come from the student. So as you're a pharmacist, try to explain, try to, involve in a patient care. So that is again, one of the aspect of patient safety. Okay, coming to the next point, like self-assessment as a pharmacist, how you are contributing to the community. So that is the example already I told you, right? Involvement, education in patient care. So some of you, involvement. So how you can involve? So say suppose you are a community pharmacy. After completion of your D Pharm or B Pharm, you're having your own community pharmacy. So in that, some patient might be having asthma. So in asthma patient, the patient doesn't know how to use the inhaler, the meter dose inhaler. So try to explain them how to use that. So that will, particularly increase the compliance in the patient. So patient will take regularly, and by that way, he can relieve that particular asthma symptom. So obviously, the next time the patient will come to your community pharmacy, going just instead of going to the other pharmacy. So that is the benefit you can think about, and then at the same time you're doing your proper work, and also you're contributing to the patient safety. So that is the case, and I want to brainstorm you in this particular introduction. So as a pharmacist, self initiation for patient safety is very important. Okay, so patient safety in clinical trials. So just going before for the clinical environment. So before that, there is a clinical trial for the every drug. So this aspect is also there in your BPharm curriculum. So patient safety in clinical trials. So how the clinical trials setup is there, and then how the patient safety will be monitored in the clinical trial. So particularly there is a IRB, the Institutional Review Board, right? So Institutional Review Board is monitoring all the process, and also they are responsible for the patient safety. Also, there is another process called as informed consent form for the process. So in that particular informed consent process, the patient will be given all the details of the clinical trials, the drug information, and then they will be given all information related with the adverse event, what are the adverse event may come and how you can overcome on it. Okay, so these are the all basics covered in the patient safety in clinical trials. So in that way, they are monitoring the patient safety, and at the any time, any point of time, the patient can withdrawn from the clinical trials if he don't want to continue that. So there is no compulsion. So once the patient having the clinical trials participation, they can come out at any point of time if they are not feeling well while doing that particular procedure. Okay, again, patient safety concerns. So what are the patient safety concerns, particularly the common types of error that mainly caused by the patient? So patients sometimes take a overdose. So that is the problem at the patient side, and that mainly leads with the patient safety concern. Nurse, how the nurse can do the mistakes and how it will be the patient safety concern. So nurse sometimes they may have the mixing of the different solution because of look-alike effect, because the label is looking like same with the other product. So sometimes they mistakenly mix the product together and then giving the wrong medication to the patient. So these are the scenarios happened already. So that's why I'm quoting the example here. Pharmacist, how the pharmacist is doing the mistake. So pharmacist sometimes there are two types of tablets, say suppose like 5 milligram and 10 milligrams. So without knowing, they may sometimes dispense 10 milligram instead of 5 milligram tablet. So that may cause a patient safety concern. The physician sometimes the handwriting also we cannot recognize by for that particular the physician. So that is again the starting point, and that may lead to the other consequences sometime. So again, the physician also sometime may not write a correct dose. That is the again one of the patient safety concern. So these are all the example of patient, nurse, and pharmacist and physician, how the common errors will occur, right? So medication error. So medication error mainly occurs like what we discussed earlier, like patient with the look-alike and then sound-alike effect. So sometimes some product particularly having a look-alike effect, okay, and some like having the sound-alike effect. So clarithromycin, clindamycin, and something like that. So you may sometimes heard some wrong medication and dispense the wrong medication to the patient. So these are the types of medication error that may occur at the healthcare setting. So healthcare associated infection. Again, as you know that hospital acquired pneumonia, right? So that is the healthcare associated infections that may occur in the hospital. Again, related with the hand washing. So sometimes the doctors, the physicians, if they don't have the proper hand hygiene, so that particular the contagious virus may have the spread if they don't use regularly the sanitizer or any other any other alcohol based particular sanitizer. So that may lead with the infection, the spread of infection. Unsafe surgical care procedure. So unsafe surgical, using the surgery and the other equipment. So they are not particularly safe sometime. Okay, if they are not properly sterile. So unsafe injection practices, again the sterility. So that product should be well sterile before proceeding for the any particular injection or any surgical procedure. Diagnostic error. So as you know that you might be heard about some incidents. Some patient they diagnosed with the corona first, and then after that they got it negative because of reliability. So that some test might be not reliable, and sometimes the patient those not having that particular condition sometime may wrongly diagnose as a positive. So that may happen, but reliability, the possibility is very less, but still the problem may come there in the diagnostic time. The error may come, we cannot deny that. Okay, unsafe transfusion practices. Okay, so transfusing the blood, or checking the blood before transfusing to the other patient. So you need to check that particular blood, the blood bank. This is related with the blood bank, right? So missing electronic data. So sometimes because of the technology failure, the hospital, the organization, they don't have the patient data. So that might be the missing electronic data. Sepsis. So the problem of sepsis, particularly in the burn patient. So sepsis problem may arise if there is no proper antibiotic regimens given to the patient, or the post-operative surgery. So this problem may arise due to the antibiotic. So the proper selection of antibiotic is very important. Again, this is a very important factor here, the venous thromboembolism, the blood clot. Okay, so many patients having this problem, the thromboembolism, the blood clot. So how to particular overcome on that, and what type of medication you are using, and what precaution you should take. So that is the very clinical relevant point in this particular venous thromboembolism. So what common misunderstanding about the patient safety some healthcare professional they are having, might be the student, or the other healthcare providers, those are working in the organization. So what are those particular misunderstanding about the patient safety? So as we discuss about the patient safety here, right? So is a broad term, and then all the aspects of care comes here in the patient safety, including the pharmacovigilance and giving the proper treatment to the patients. So that all covers in patient safety. So what is the misunderstanding? So it's not only about reducing the adverse drug event. So also you need to maintain healthcare quality. So healthcare quality is also important. So what healthcare quality aspects, what that particular includes? So it's a safe environment, effective treatment, patient-centered treatment, and then you should have the timely follow-up, efficient and equitable. So all the treatment should be equitable to all of the patient. So it should be same to all the patient. It should not be depend on the person to person. It should not vary. Okay, so these all the healthcare quality comes here in the patient safety. If you're not including any of the parameter, sometimes that may lead with the complications and the problems with the patient safety. So that's why these all factors are important instead of only focusing on the patient safety, because ultimately these all factors, those are mentioned in healthcare quality, that somehow they will affect patient safety at the last. So you should be more focused on all these aspects so that your patient safety will be safe. So coming to the next point is like the international patient safety goals. So these are some international patient safety goals given by the international organization. So identify patient correctly. So this is the most important point, like identify patient correctly. Sometimes what will happen, in ward there are many patients with the same name, and then the nurse may give a wrong drug to the wrong patient because of having the same similarity in the name. So identify the patient correctly first. This is a much important point. So you need to focus here, identify patient correctly, double confirm it with the age, name and everything, and then start your procedure instead of not communicating with the patient first. So the communication plays a very important role here in the identification of the patient and giving the correct dose by the correct route and at the correct time. That also matters. Again, improve effective treatment, care, and the communication. So communication is important while improving the care as well as just passing the information to the higher authority. Say suppose like nurse will pass the information to the doctor, to the pharmacist for taking the proper steps ahead in that particular time. Improve the safety of high alert medication. So those are high alert medication. Those are, coming in the category of high alert medication. So that should be stored in lock and key. So it should not be just simply keep in the shelf. So that particular care should be taken by the organization. Ensure correct patient site, procedure, and surgery. So whenever you're going for the surgery for that particular patient, so select the proper type of surgery, proper procedure, and site and patient. There are example I saw, in the well-reputed website, they have mentioned that, what mistake particularly the physician did. So they removed the, instead of right kidney, they removed left kidney of the patient. So that is the, mistake, error caused because of non-communication and not following the proper procedure, not following the checklist, not following the standard operating procedure in the organization. So this type of mistakes may occur. So ensure correct patient, site, procedure, and the surgery. That is important. So if you're removing the other part of the body, so patient, you're harming the patient harm will occur in that way. So you should be well trained, you should be having proper SOP, you should be having proper knowledge and training. So training and knowledge is much important in this aspect. So reduce the risk of healthcare associated infection and practice the hand hygiene. So I given earlier the hospital acquired pneumonia is one of the example here that may, the patient may get in the hospital. So every time you need to think about the patient safety first and reduce the risk of patient harm resulting from the fall. So this is the another way, sometimes the patient is admitted in the hospital as an inpatient and meanwhile getting wake up from the bed. Okay, so if he don't have any assistant, so sometimes the patient may fall down, and there are many cases reported in the literature. So this incidence is very common in the hospital. So that's why the hospital need to take a proper precaution for it. So they should prevent the following of particular old age people. So they can assist, the nursing staff can assist them while getting wake up from the bed, and then it will be easy for those particular patients, those need the help in that aspect. So ensuring patient safety in healthcare setting. So focusing on below key areas. So I have given some key areas. So that particularly focus on the patient safety, how we can ensure the patient safety in the healthcare setting. So that particularly facilitate the sustainable improvements in the patient safety, enhance the patient experience, reduce the risk and harm, and achieve better health outcome and lowers the cost. So that includes all. That includes, right from the building of the hospital and bed of the hospital, how is the, airflow in the hospital setup and everything compared to all our olden setup of the hospital. So there are many things coming under the patient safety if you want to have the proper safety measures. So as like earlier we discussed again the WHO, right? Patient safety, a global health priority, and speak up for the patient safety. So this is the first point. Here is a safe building design. So whenever it comes to the design of the hospital, so whenever you are comparing the traditional versus modern hospital building setup, so you can see our traditional hospital setup, how it look like, and now you can see the modern hospital build-up setup. Okay, so what particularly difference is there? So now you can see the information access and then noise level and scalability. So now we can have the small room in the hospital instead of having the one big ward. So that will reduce the risk of getting harm due to the contagious virus. Say suppose like today's scenario, the coronavirus, the patient should be isolated in the one, the room. It's not like the ward, right? So that particular things will reduce the risk of infection to other those not having that. So that is the main difference in the traditional and modern hospital. So engineer particularly, they have taken efforts to minimize this type of infection because of the feedback from the organization, or from the hospital side. So other factors like air quality, critical information proximity, and noise dampening, standardized feature location, features that reduce the contagion spread. So that is the spread of virus or any other bacteria, from one person to other. And obviously for reducing all these things, we should have the proper measures. Say suppose like employee hand sync in all the treatment area. So once the treatment done, the employee, the doctors, the healthcare professional, they should wash their hand at the same time, so that particular virus or any other the virus or bacteria, that should not spread from one space to one place to other place, because some viruses, as like we cannot see them, right? So it's invisible, so that may transfer from one to other by simply by passing the paper. So in that way we need to be very careful. Safety and health management system, so there are guidelines. So guidelines, particularly the organization, they should know their guidelines, their vision, their missions. They should have their policies, they should have their checklist. So say suppose going, I told you one incident, right? The kidney, the patient, the particular, that particular doctor removed right kidney instead of left, or vice versa. So in that case, if they have the proper SOP, so before going for the renal transplant, before going for the kidney failure patient operation or surgery, they should have the proper SOP, proper checklist. We can say a checklist is a new parameters coming into the health system. So before going for that, they should have the checklist. So they need to follow the SOP, the standard operating procedure. So by that way we can reduce the harm in patient, and that is the one aspect of patient safety. There are many incidents you might be heard about, like while doing the operation, the patient, the particular physician, he forgot to bring back the seizure from that particular area after the surgery, and that is the cause why the patient is having the bladder pain after some time, after some days. So meanwhile they detected then what mistake they did. So this type of mistake we can avoid by having the proper SOP, checklist, and the proper procedure to all the organizations. So that's why you need to be very careful for your SOP. And also if you have vision and mission, you need to review it after a certain period of time, and again also try to get feedback of all the employees and managers, and by that way you can improve in a safety protocol. So that all comes in safety and health. Again, coming for the policies, so as I told you, the checklist, right, guidelines, and then organizational safety, including the new employee training. So training is very important. So again, I want to quote here one example. I gone through one of the reputed website, and they mentioned there. So because of one patient given penicillin, and then the next day, after some time, the rashes came. Again, next day they have given the same penicillin, and sometime afterwards the patient died. So don't know why the patient died. So that is the lack of training, lack of knowledge. Sometimes the new particular the healthcare professional, they are treating the patient. So that is the case why we don't have many resources. So lacking resources is another factor in the healthcare industry, in the healthcare setting. So that might happen due to the improper knowledge for that particular healthcare professional. So we need to have the proper training for the new employee. Those are joining the organization, right? So administrator, what is the role of administrator? So mainly related with the policy changes. So whenever you are getting the feedback of your employee and then all other manager level people, so you need to update all regularly for that particular policy. An employee must understand the duties, so each should know the duty of everyone, and then they can uphold the patient safety in that way. So again, coming to the next compliance plan, following the safety compliance plan. So these are the aspect, community trust. So by that way, you will get the community trust. So like people, mouth to mouth publicity. So the patient, the patient, those are recovered from that particular, disease condition or surgery. They will have the mouth to mouth publicity, like, this hospital is good. So in that way, you can have a community trust on that particular organization or the hospital. Maintaining insurance claim integrity. So insurance is also one of the factors. So many people, those having the insurance policy, so if they are getting a proper treatment in that hospital, obviously the people, the patients will have the more reliability on it, and by that way you're maintaining the claim integrity in that aspect. Promoting positive treatment outcome. So if you have proper SOP, proper checklist, and proper patient communication, so that ultimately promotes the positive treatment outcome, and also at the last, patient compliance. The patient will get compliance by having all the treatment procedure. So compliance standards, mainly that includes the community and the organization. So it will be helpful for both of them, community as well as organization. Mitigating or eliminating illegal activity. So you should not have any illegal activity around your premises that mainly affect the community confidence on that particular organization. And establishing a framework to evaluate employee and vendor compliance. So there are many vendor, right, third party involved in your setup, the healthcare setup. So you need to get feedback from them also. So as a better organization, you are doing the feedback reviewing from all the vendors, those are involved in your healthcare setting, and by that way you can improve the patient safety. So ultimate aim of us is to ensure the patient safety. So how we can ensuring the patient safety? By improving the communication skill or the communication in clinical teams. So everyone should have the proper attitude, knowledge, and practice of doing proper communication. So if you don't have that communication, ultimately it will lead to the error at the last. So whatever the procedure the nursing staff is doing, that ultimately should reach to the doctor or the pharmacist who is relevant for that particular process. So proper communication ultimately reduces the patient harm, and it will be important in patient safety aspect. Reporting and learning from high level and serious untoward incidents. So untoward incidents means, like I told you earlier, right, adverse drug reaction reporting to the National Coordination Center, and lastly to the CDSCO, Central Drug Standard Control Organization, and ultimately it goes to the World Health Organization for the review. Okay, so reporting and learning from high level of untoward incidents, that is adverse drug event, is very helpful for all other healthcare professionals to know about that drug and what type of adverse effect may come if they are using that particular drug in the patient care. Following evidence-based clinical guideline and protocols. So this is some time is lacking in the Indian setup. Following evidence-based clinical guidelines, you can see the many scenario, right? So some of them, they use chloroquine to prevent the corona attack on them, right? The prevention measures, the prophylactic measures. So they use the chloroquine. Some, they died because of the heart attack. They died because of the heart arrest. So it's not like everything you can take in any condition. So it's depend, like sometimes the patients have the contraindication, that drug is not particularly suitable in that particular patient. So in that way you need to be very cautious while ensuring the patient is taking the correct medication. As a pharmacist, you should tell them, you should counsel them how to take that medication and what may happen, if you're taking in excess. So some, they took that particular chloroquine in excess, and many patient, they died because of the heart arrest, heart attack. So that is the case, the clinical guidelines and protocols. So as a pharmacist, you need to follow that. As a healthcare professional, as a physician, as a the student, you need to follow the clinical guidelines. So there are many clinical guidelines, like as recently ICMR, right, Indian Council Medical Research, they given some guideline related with the use of antiviral in corona pandemic situation. So follow that guidelines. So because that guidelines are evidence based, so evidence based is also important. So whatever the medication given there, whatever the treatment protocol given in that particular guidelines is appropriate, and that is evidence based, because they tested already in the people, and those people got the positive outcome, and that's why it's a evidence based medicine, right? So I believe you know about the evidence based medicine, right? So additional policies and strategies. So in addition to earlier policies and what strategies we should have for the patient safety, so these are the other additional policies you can think about as an organization. So what are the other risk management strategies, and then serious untoward incidents policies and infection prevention and control annual plan, so this particular infection prevention and control annual plan, so as we discussed earlier, like the hospital acquired pneumonia, so you can prevent that happening to the patient. So in that way, you're taking care of the patient. So that is aspect of patient safety. Clinical audit and effectiveness strategy. So get a feedback from all the patient, all the authorities involved in the patient safety, and by that way you can have the organization clinical audit. Research and development strategy. So again, organization should be think about the research and development strategy. So what should be the research? So say suppose, like about drug utilization evaluation, right? Drug utilization evaluation or drug utilization review. So it's a utilization. So what is the basic concept regarding drug utilization evaluation is that you are going to check how is that particular drug is utilized in the hospital. So by doing some research, a simple research, you know about what are the top 10 drugs that prescribe in the hospital, that particular organization. And then think about whether it's really needed, that top 10 drugs. So sometimes you think about the example of ranitidine, right? So ranitidine mainly consumed because of the gastric problem, because of the acid problem, gastric acidity, right? So nowadays the ranitidine use is questionable, okay, because of the other the latest other evidence-based reason, right? So in that way, the ranitidine much used in earlier olden time period. So in that way, we need to do some research and see what are those drugs mainly prescribed in the hospital, and need to check whether that is really important to give to the patient. And in that way, you can see what are the antibiotic also prescribed to the patient. So this is the basic research. But again, apart from the basic research, what you can do, you can have the clinical audit, you can get the problems, the clinical problems, you can get the feedback from all the employers, all the vendors, and by that way, you can have some other research, the innovative research one. And at the same time, you can analyze the root cause analysis procedure. So what is the root cause? Why this problem coming again and again? So that is the analysis procedure you can do. Training and education strategy. So obviously the person, the educator or whoever is a lifelong learner. So that might be the prescriber, that might be any other healthcare professional, might be the pharmacist. So the learning process is not only the time being, is a lifetime. So that's why it's a lifelong learning. So you need to be trained, you need to be educated, you need to read a lot of literature, you need to be evidence-based. Then only the patient will get a proper care. So that is the important aspect of patient safety. So improving communication in clinical teams, and reporting and learning from high level serious untoward incidents. Okay, following the evidence-based clinical guidelines and protocols, and also the antibiotic resistance. So these 3 points already we discussed in somewhere in the earlier part. Coming to the antibiotic resistance, so this is the again more problem nowadays. Some people, they are taking, some antibiotic as such without prescription and, over the counter. So sometimes they may have the antibiotic resistance if they are using very regularly, and may cause some type of hepatic or, kidney failure problem or any other problem if they are having the concomitant use of antibiotic with the other NSAIDs, like non-steroidal anti-inflammatory drugs, like, the paracetamol is like, even safer, but other drugs like diclofenac or aspirin or any other NSAIDs like ibuprofen. So these drugs may cause severe problem, as we discussed earlier, warfarin, right? So warfarin also having much drug interaction problem. So that might be, severe or moderate or the light type of, interactions. So in that way, we need to be more cautious using the antibiotic. So because that may lead to the patient resistance. So coming to the next point is preventing inpatient falls. So as I discussed you earlier, this is the most identifiable patient cause nowadays. You can see the many literatures on patient falls. So while patient is admitted in the hospital, sometimes the patient fall down in the hospital, and that again leads to the other consequences. So obviously the patient will be hospitalized in the hospital for a longer duration, and then increase the length of stay. So by that way, you're reducing the quality of life of that patient, because ultimately after the fall down, the patient have the pain at that particular site, and that reduces particularly the quality of life of that patient. So costly sometime to the patient as well as to the hospital if they have this type of the other problem. Instead of, treating the disease condition alone, they are facing the problem with the falling down. So identify patient correctly is also one of the aspect related here in the falling down. So know your patient, know his capability, and again by that way you can help patient in a proper way. So those are patients having age older than 65 or 70 years. So you need to be very cautious. The organization, the nursing staff should be very cautious about this type of particular patient. So what preventive measures the patient should, the organization or the patient should take? So patient should inform to the nursing staff well in advance that they need assistance for this type of activity, and also the organization to have some proper methodology to, proper steps or proper, process or the procedure to call upon the nursing staff help, and by that way they can help to that particular older people in the hospital. So that ultimately reduces the risk of falling down. Patient and practice centered care and patient involvement. So obviously the patient centered care is much appreciated, as you are involving the patient and also the family members of the patient. Okay, say suppose in this critical condition, like the patient is having the cancer, so discussing all the things with the patient is sometimes is not possible. So at that time you need to consider the family members of the particular patient, and that will be very meaningful and valuable in regards with the treatments. Okay, so that includes following principles. So what particular principle involves in a patient centered care and also the patient involvement? So the first one is respect for patients. Okay, so what respect you should have for the patient, like his preference, express need and values. So everybody is, everyone is not same. Everybody is having the different preferences, different own unique values. So you need to respect that, and then involve the patient in decision making. So if you're doing some surgery, so tell the patient, if possible, the procedure and all other things, and then try to involve him in that particular treatment and surgery, and by that way he can understand the procedure properly. So that is the case why decision making, the patient decision making, okay, is very important here. Treat patients with dignity, respect, and sensitivity to his her culture, values, and autonomy. So one should respect the patient dignity, respect, and also the sensitivity towards its cultural values and the autonomy. So that also matters in patient safety. So now you can understand patient safety is not alone, minimizing the adverse event alone, but it's, having a lot of things to be discussed under the patient safety. Another thing is patient education, health education, and promotion. So again, clinical status, progress, and prognosis. Prognosis means, like, what will be the outcome, what will be the possible outcome after giving the treatment in that particular clinical condition. Okay, so in that way you need to educate the patient. So that includes health education and promotion. So in regards with the health as well as his particular disease condition, you need to educate the patient in a correct way, and that particular education will lead with the proper patient safety. Physical comfort. So physical comforts mainly include, as we discussed, the building, right? So building also matters. So hospital surrounding and environment, and also the pain. Pain is very subjective. You cannot, you cannot feel the other's pain. So that's why, pain management is very critical in some critical conditions like cancer and, other conditions. So physical comfort is also important, how you are going to manage that pain of that particular patient. So as we know that, starting with the normal NSAID and going to the opioid analgesic and, higher analgesic. So that's why you should have a SOP when to use particular which type of pain in pain management. Assistant activities, daily living needs. Okay, so what is the daily living needs of that patient, and then assisting activity, like, maybe the patient sometimes needs the assistant from the nurse if the patient is, old age. Emotional support and alleviation of fear and anxiety. So these are the particular, components comes here in palliative care. Palliative care mainly in the patient, those having the critical conditions like cancerous patient, those having, the other critical conditions. So in that case, the emotional support and elevation of fear and anxiety is very important. Physical status, treatment, and prognosis, and that also impact on the family. So sometimes patients family also get, fear, anxiety, because of the patient is having the chronic condition. So in that way you need to manage that patient family also. So these all parts coming under the palliative care. So palliative care is also component of patient safety. So is a broad term patient safety, and all other components are helping to have a proper safety for the patient. Financial impact. Some patients may have the fear, anxiety due to the financial impact, like they lose their job, or, they don't have any resource for the financial thing. So obviously financial impact will affect the patient. Involvement of family and friends. So might be organization may think about their accommodation, family and close friends decision making procedure in the surgery or any care for the patient. Supporting family or caregivers. So that particular family, though, that family should support to the patient, as well as the organizations should support to the family members of the patient as well as caregivers. And also needs family and friends. So in that way the decision we need from family as well as from friends, because for every decision we cannot take opinion of patient in some situations. So that their role is also important in that case. So coming to the next point is innovation and research. So as we discussed earlier, we can do the basic research like, drug utilization evaluation or review, or, rational in prescribing medication. So we know in that way, like how many drugs are prescribed in the hospital, top 10 drugs. And then we can think about whether these drugs are really important to give to the patient, and by that way we have the evidence-based approach. Just you need to refer the recent article. So like I want to quote here the example of, again, coronavirus. So coronavirus, many countries having the different treatment strategy, So what is the evidence-based approach? So now there are many research articles already published in this aspect, so you can refer that and then find out what is the best approach for this particular pandemic. Again, you can have some research collaboration with the other outside outside in that particular different country, from who that wherever you're staying in that particular country, you can have the collaboration with the outside institute or organization, maybe outside in your country or maybe within the country, and by that way you can have some integration in the research. So communicating with each other also opens many ways for the new research, and also ultimately that will be helpful in monitoring the patient safety. So technology, sometimes the technology fails, as you know that sometimes we are not able to connect, technology fails, and in that case of technology failures, you need to be prepared to have some backup plan in that aspect. So these are the references I use for this patient safety. Okay. And just the last message I want to give you here is, let's contribute to the pharmacy education and research by enhancing quality education. Okay, so with this, I will end my presentation, and then I will just stop sharing the presentation, and then we'll start with the question and answer session. If you have any question, you can please let your faculty knows, and then I can answer that. Okay. Yeah, Vyavara sir, now you can access from your end. Can you please check now?
Yes, sir.
Yeah. Please proceed, and then let me know if you have any question.
Thank
you, sir.
Yeah.
It's a very yes, sir.
Yes,
Thank
yes.
you very much, sir. It's a very nice session as you differentiate the different healthcare facilities. Then, in very nice manner, you are going to explain the differences in patient safety versus the pharmacovigilance. Then, different international patient safety goals. Then, all the participants really know about the patient, ensuring patient safety in the healthcare settings, as well as the participants also know about the different guidelines of safety as well as the health management systems. Then what are the different additional policies or strategies regarding that ensuring patients safety? So there are some questions regarding that, sir.
Yeah,
The first
please.
question, yes, sir.
Yeah,
Sir,
please
first,
proceed. Yeah.
sir, the first question is that from Dr. Santosh Surana, Loknethe Dr. J.D. Power College of Pharmacy, Kalwan. So, what about the practical exposure of adverse drug reactions, that is the pharmacovigilance to students?
Practical exposure means you're talking about the clinical attachment, or what?
Yeah, yes, sir.
Okay,
that means the
okay. What I understand from your question is that, right? So how the student can participate in the adverse drug reaction reporting in their learning process, right? So when they're learning, when they are studying in their B Pharm or D Pharm. So as I told you, there is an app, right? So if you're involved in clinical attachment, or if you are involved in any other healthcare setup, so you can inform to your higher authority. So if you found any type of adverse effect or side effect, you can learn from it. So it's not always like reporting adverse effect is necessary, but sometimes some adverse effect, side effect are well known. So in that case, there is no reporting required, right? So only reporting required in those scenario, those are unknowingly happen. So those are unknown incidents. Only in that case we need to report to the higher authority. So there is a form also available, an adverse drug reaction reporting form, right? So if you are visiting to the CDSCO New Delhi website, right? So in that CDCSCO website, you will get all the relevant information when they started, this pharmacovigilance program, and then when they hand over this pharmacovigilance program to the PCI, the Pharmacy Council of India, and how the Pharmacy Council of India is having the active involvement in the all ADR reporting process. And finally, it goes to WHO, World Health Organization. So at this point of time, what student can do, student can refer in their curriculum. I think I know that in their curriculum, they have this topic, right? Pharmacovigilance. So what faculty can do,
Yeah, yes, sir.
faculty can, elaborate the topic, and at the last, what they can do, they can tell the student, practice how to report adverse drug reaction. So give them some scenario. Okay, so examples are also available online. If you are going through the YouTube video, you can go through the, the some Google. If you are typing some keywords also, you will get some scenario, So that particular, you just go through it and then see what type of particular example you can tell to the student, and tell them to fill the adverse reaction reporting form. So why I'm telling you now, because in this our Indian clinical scenario, so we have not grown yet up to the level, comparing with the Western countries, Western world. So now PharmD students are upcoming, right? In some of the Maharashtra region, also some colleges are there. So they can practice of, reporting the adverse drug reaction. So just give them some the mock scenario. It's like, for their practice. It's not reporting really to the CDSCO, but you can just make a mock scenario, like it will be for their practice. So just let them practice and let them see what are the mistakes they are doing. So that particular, the learning process will be helpful for them if they are going to be clinical pharmacist in coming time. Some may go for the industry, some may go for the hospital organization. So some may have the community pharmacy, some may go for the clinical pharmacist. So ultimately, this will helpful for them to go to the next level and see how we can report the adverse drug reaction reporting. Because I did some research in this area, and many of our healthcare professionals, they don't know even how to report the adverse drug reaction, where to report, who can report, when to report. And there are many questions. So give a proper instruction to the student, give them resources, from which resource they can use which material, and then you can train student accordingly. Because they're not practicing really, right, in the hospital. They are just working as a student. So at this level, they may not aware about the many things. So they need to take the help from the higher authority in that particular regards. Okay, is that okay?
Okay. Yeah, yes, sir. That means if we put that different case studies of patients in practical, so students will know about the different
Exactly,
practical exposure of that ADR. Okay.
Exactly,
Sir,
yeah.
next question is from Dr. Atul Shirkhedkar, sir. So
Yeah,
is
sure.
there any role of anticoagulant, or we can say that platelet in COVID-19 treatment? So what is your opinion regarding that, sir?
Okay, antiplatelet, like, this is a good question. Actually, it's a, like, clinical based question. So it's
Yes, sir.
depend, it's depend on the patient to patient. So in every patient, we give anticoagulant, but again at the same time we need to monitor the INR level of that patient. So if it is within the range, we need to calculate the dose accordingly. So it's depend which comorbidities the COVID-19 patient is having, so depend on that particular case, it may vary. So actually I cannot tell you whether it's going to be useful or not, but it's depend on the case to case. So sometimes the patient may have the more dose, or sometimes they may not require the dose. It's depend totally on their clinical scenario, what comorbidities they have in that particular condition, and what is their INR value. Okay, so that is the international normalized ratio. So we need to think other clinical parameters also, instead of just starting with the antiplatelet. So sometimes it's might lead to the bleeding, as I told you earlier, right? So again, what concomitant the drug therapy the patient is taking. So other drug therapy also matters. So if the patient is on other drug therapy, so that may also increase the incidence of particular bleeding. So we need to be very careful while monitoring the patient in this particular scenario. And as you're using some drug, again you need to check the drug interaction with concomitant drug therapy or whatever the drug therapy you are giving for the COVID-19, because in COVID-19 also we have a certain type of medication. So we don't have we have a lot of debate on that, which type of drug should be used in the COVID-19 situation. So sometimes it's vary from person to person, or physician to physician, or what type of particular guidelines they are following. So in India itself, you can see many literature are there, how they're using the standard guideline, how they're using the standard treatment in the COVID-19 situation. In many other country, what antiviral drugs they are using. Now you can see the ICMR, what they are recommending for the COVID-19. So it's depend which type of therapy you're using, and then what clinical significance the comorbidity the patient is having. So it's depend on all the whole factors. So we cannot come to the conclusion while only giving whether we can give or not. So we need to think about a lot of other parameters, and after that we can decide whether to give in that condition or not. Okay, thank you. Ani, is that okay, sir?
Yes,
Shirkadkar
yes,
sir?
yes.
Am I audible
Wonderful.
to you, Shirkadkar sir?
Yes. Hello.
Shirkadkar sir is there online?
Yes. I am on the line.
Yes, sir.
Yeah.
Okay.
Can I speak right?
Yeah.
I am audible to you?
Yeah.
Yes. My compliments to Dr. Praveen Kumar Ingre and all Dr. Taile sir and the team of Matoshri for
Thank you,
organizing this wonderful, you may say that of the webinar one. After a gap of, I think, a long period, we are now interacting with each other on the webinar one. Actually, this was the question that I wanted to ask to you, being a, you may say that of the clinical pharmacist or the clinical who is looking after that of the clinical side. And the second question that I wanted to ask to you on the behalf of all the people, those who are on that of the panel one, that is, I can say what is the Singapore model to prevent, you may say that of the COVID-19 situation or pandemic situation one. Singapore model, which is generally been appreciated by worldwide, that is how they have controlled the, you may say that of the pandemic of COVID-19 one.
Yeah.
Mostly appreciated.
Yeah, that's good question. Yeah, actually what they did, so we need to basically break the cycle, right? So that is the basic requirement whenever, if you're thinking about the coronavirus. So it should be, we need to have the social distancing, and then we need to take care in the hand hygiene and personal hygiene, so in that way they have mainly concern about the basic points, the hand hygiene, the personal hygiene, and also about the keeping social distancing. So in that way they are, they are able to particular stop the spread of the COVID-19 in much way, because the other Western countries, if you are comparing, so sometime, we can say we need to accept, the reality. So as like many other countries, they have not taken that,
Yes.
things in a very serious, manner. So basically, it only not comes from the government. So we need to take an initiative. The people should be well educated, and they need to take their own initiation, rather, just waiting for the government, the what we can say, the government, some order, or the some notice. So you need to be self initiative, and you need to take your own decision how to prevent in this pandemic situation. So ultimately the government is doing at their best, but at the same time we need to take our own initiation, and also we need to think about how we can prevent this particular break of the cycle of coronavirus. Okay, is that okay, sir?
Yes.
Yeah, yeah.
Thank you.
Yeah.
Thank you. Wonderful one. The wonderful
Yeah, yeah.
presentation, and
Thank you,
you
thank you.
said
How
that
are you?
I am fine. Wonderful.
Okay, good, that's great. Thank you.
Yeah.
Junagade, sir.
Thank you, sir. Next question want to ask by Professor Junagade, sir, SPH College of Pharmacy, Malegaon. Junagade, sir.
Yeah, please.
Hello, Junagade, sir.
He raised the hand. He is unmuted. Okay, you can take the next question.
Okay, next question. Sir, you mentioned that different healthcare facilities. Okay,
Yeah.
but now in India, all these facilities are clubbed in a single option, that is in hospital. So, what is
Yeah.
the difference in between that?
Yeah, but still, in our Indian setups, some they have their own personal clinic, right? So in that, mainly what we can see, like inpatient facilities there, also the outpatient facility. Some they have only the outpatient facility, they don't have the inpatient facility. It's depend, because they don't have the that particular space, right? And some now in our Indian setup, now the scenario is coming like, all doctors are coming together, and in one building they have their all the things. But if you are comparing with the Western world, they have their own, hospital. Say suppose like childbirth, right? So maternity, so they have only that particular setup. So if some pregnant women, they have the complication, they cannot, treat that particular, patient in that setup. So because they don't have the other, setup in that same hospital, so that is only restricted to the pregnant lady, the gynecology, so that particular branch. But in Indian setup, now the scenario is growing, and now we are moving to the having all clubbing together, all the doctors are coming together, and some only we have the radiology, right? So radiology, we can see like there is a separate hospital, so that particular, devoting with the X-ray, devoting with the MRI, and other tools. So that is a diagnostic center. So still we have in the India, the diagnostic center is a separate, right? But some now the scenario is changing, and now the all doctors are coming, together and clubbing at the one setup. So it will be easy for the patient to get, access of the all healthcare facility. So in one way it's good. Yeah.
Okay, thank you, sir. Next question want to ask by Mr. Satish Nandude, sir. SciTech Healthcare, Sinnar. Mr.
Yeah.
Satish, sir.
Can you hear me?
Yeah, please.
Yes.
Yeah.
So it's a very nice and informative webinar actually.
Yeah, thank you.
My
Yeah.
question is how pharmacists can play a role in patient safety in current scenario. See, in India, it is only counseling. Pharmacist can't do anything. He has to follow instructions of registered medical practitioner.
Yeah.
Whatever he remain only a dispenser.
Yeah. Okay.
And so see, we all learn adverse drug reaction and everything, but it all comes to registered medical practitioner.
Yeah.
Even a pharmacist cannot dispense a brand whatever registered medical practitioner prescribes, whatever he wrote, that brand only the pharmacist has to give. So what role of pharmacists remain in our healthcare system in these days?
Yeah, yeah, that's actually, real practical question we have in our setup nowadays, right? So from the olden days, we can say rather. So it's from long time we have that particular practice, right? So that's why I told we need to be more patient involvement. So at the same time, we have some hurdles. So in that scenario, the attitude is matters, right? Attitude. So attitude matters. So attitude might be, the healthcare professionals. So in doing our all the practice, like maybe, dispensing the medicine, or writing the prescription by the healthcare professional. So everyone should be professional, have some ethics, have morals. So all we are working for the patient safety ultimately. So say suppose somebody is doing mistake and we are identifying them, so it is a duty of doctor to accept it. Okay, so if they won't admit, okay, if they don't admit it, we cannot do anything, right? But whenever, if the law of pharmacy and the pharmacist role, what law says? So law says that as a pharmacist, you are not only the dispenser, but at the same time you need to assess the prescription that is given by the physician. So that's why you should have that particular knowledge. So many of us even don't know how to identify the drug interaction in the prescription. So that's why I brainstormed with this session earlier. If if you know the ways, and if you know the mechanism, like how there is a drug interaction occurs and what is the better option for that particular drug, and you need to convey that message to the doctor. So if you are able to do that, ultimately one day it will come that they will recognize the role of clinical pharmacist in the practice. So that I believe in that way. So we need efforts from all the pharmacists, those are coming in recent time in the practice. So that's why the practice should come in their learning itself. So learn the teach and learning from the student and teaching by the faculty. So we need to teach the student accordingly, and also the student need to learn accordingly. So say suppose you want to check, there are 10 drugs in one prescription, so already it's a polypharmacy, right? So polypharmacy, how you can check the drug interaction? So you can see the many apps are there nowadays. Again, there is a Medscape, the medicine info, you can check online. Okay, you can check online and you can check the drug interaction in between two drugs. So in that way you just convey that your message to the doctor, the registered the medical practitioner, and then you come to the conclusion. Okay, this drug is not safe to this patient because this having the drug interaction. Maybe the patient is having the renal failure, maybe the patient is having the hepatic failure, any other contraindication. Okay, so you need to be rationalized in that way, and if you're able to do that, then obviously the physician need to listen you. Okay, so that is my answer for you. But here, like many of us, we don't have that many patient involvement. So just what we will do, like if somebody is prescribing, like we are dispensing, so that why so that there is a misconception. So it's not like that. You can even counsel the patient. I will correlate this question to the current scenario. So say suppose those patient at higher risk of corona, so those are the patient, so those particularly having the background of tuberculosis, those having the background of asthma, those having the background of diabetes, the immune compromised patient. So those patients mainly at high risk of getting the coronavirus. So in that way we need to just maybe at local level you can have your association. So just in meeting you can have like get some consequences and then come to the conclusion that you can do something for the patient. So maybe like, simply giving the leaflets, or giving the information to the patient, so it will be really helpful. So in that way patient will recognize you as a pharmacist. So the patient will recognize you. Okay, these are the the steps I need to follow if I'm having this problem. So what are the precautions should I take? Then what is the food that I can eat in this pandemic situation? So obviously you should not eat the foods that are not recommended in this particular scenario. So ultimately you need to come up with this particular stage, and then only you can see obviously there will be a change in coming time. Okay, so I know that long back, Dr. B Suresh, he took an initiative and then he started JSS Uti, the pharmacy practice branch, and JSS Mysore, right? So he took initiation in this particular pharmacy practice, and then we learned many things from the Western countries, and then we try to follow that, and now you can see the growth of PharmD, and maybe in coming time we can say it will take time, but we can see the hope that we will be better in coming time, right? Is that okay? Am I answer to your question?
Yeah, it is a long process.
Yeah, obviously it will take long time. Yeah.
Okay, thank you, sir. One more question. As we know, in India, the Ayush Ministry uh, recommend the homeopathy medicine, that is the arsenic album 30, as an energy booster, or we can say immunity booster, to mitigate the spread of coronavirus. So what are your thoughts on it, sir?
Okay, so I am not the, first of all, I am not the expert in homeopathy, but still I will give as my opinion as a pharmacist. So I'm not sure about the homeopathy, but still, immunity you cannot build up in one day. That is my thought process is saying what I learned from in from 2021 years in my time period in my career in my from the student life. So immunity will build up because of a lot of things. You have to do a lot of exercise. You need to do a lot of exercise regularly. You need to have your health status properly. Okay, so it's not like taking a tablet and then boosting your immune power. Okay, so for that you should have the nutritional food, right? So there are many factors. First of all is diet and nutritional aspect, the diet and exercise. Okay, stress management. Okay, again the other things like meditation, some are doing it, right? So we know in our conventional time, from the conventional time, what is the importance, what is the rationale of doing the meditation, what is the doing of yoga. So ultimately it's a long process. Immunity you cannot build up in one day. I'm not commenting on the question you asked me because I'm not the expert in homeopathy, but what I believe is that, okay, start from today. If you don't have the proper immune power, or due to any reason, okay, so follow proper diet regimen. Take a nutritional diet instead of eating the junk food like pizza, burger, or all the oily foods or the fried foods. So try to have the balanced diet, and then by that way you can build up your immunity. Is that okay?
Hello.
Yeah.
Yeah, myself MS Dunagade from SPH College of Pharmacy, Malegaon.
Yeah.
I want to ask one question, that how can we increase the contribution of pharmacists in the hospitals to ensure the better patient safety? Means what our government should do to improve the participation of pharmacists in hospitals.
Yeah. So might be you heard about some earlier debate was going on regarding the PharmD student, right? So
Yeah.
PharmD student, now I believe, like in the PCI meeting, I think is in earlier PCI meeting they raised this point, and now they accepted PharmD as a clinical pharmacist. So I don't know whether it's like GR came now or not, but now they are thinking on that. Okay, so they are having the specialist role, clinical pharmacist. I believe I saw that Pharmacy Council of India website, and then I think they agree on this particular role. So every hospital, they should have the clinical pharmacist in it. So that's why the family people, the family student, they should be trained in such a way that they should know the basics. If they're going to the hospital, what they need to do. Otherwise, if you don't know your vision, mission, and your goals and your SOP and your checklist, how you are going to assist to the patient, how you are going to assist to the doctor. If you are comparing with the Western world, you see they are working in a team. So teamwork always works, So it's about the attitude of the people. So if you are working in that environment, obviously you will grow. And if your attitude is like that, if you don't want to accept the change, if you don't want to accept the new fact, then we cannot help in that way. So ultimately the attitude plays important role in that way. And now we can see the changes is happening. Maybe it will take time, but hope we can have better patient safety in coming time.
Yeah. Because
I can say,
pharmacists
on this question, I can say I self-assess. I don't want to reveal the patient, patient identity, but I say I watch the patient, the physician, those given, antiviral in pregnant lady. And then I communicated to the physician in that way. Again, in some child, I saw that patients are, giving sulfamethoxazole plus trimethoprim. So that is, may cause some, the brain problem, the kernicterus. So that may happen. So why to take risk? So that's why the patient safety rules come in. So I told you earlier, like, start from your home. If somebody is at your home, as you're a pharmacist, you don't know about the evidence base, you are not sure about the medicine given. Try to understand from the clinical guidelines, why this drug is given to this particular patient, why the medicine is given. Is there any interaction in the prescription? You can see those patients over the age of 60, 65 in hospital, they may have the more than 10 drugs at a time. Try to see that polypharmacy aspect. Try to see the drug interaction in it. Again, try to see whether the patient really knows how to take the medication, why to take this medication, right? So actually the patient should know, but it's the initiative comes from patient side. Okay, so patient also need to be more involved in his own care instead of the one-way process. It's like our lecture. So as a lecturer, we are going into the classroom and just we are delivering as our lecture, right? So in our conventional teaching, the teachers are coming to the classroom and teaching to like a student just listening to them, and then after 1 hour the lecturer will go. So if in a modern era, it's not like that. So it's a two-way communication. So if the student are communicating with you at the same time, the process of learning will be more better instead of communicating with at one-way process. So that is my opinion on it, right? Yeah, thank you. Yeah, is that okay?
Yeah.
Dr.
Thank you,
Praveen,
sir.
last question.
Yeah, please.
It is somewhat outside the topic.
Okay, sure.
What difference you observed in teaching scenario in India and in their Malaysia?
Yeah.
You compare, because now we have to use all the ICT tools in this pandemic situations, and in India also all the teachers are going to use all the tools in future also.
Yeah. That's that is a very relevant question, sir, and that is the need of time now, right? So actually in India, what curriculum we have, so we don't have much MCQ. Maybe now some university they started, and the PCI also, I think with their new curriculum they embed some MCQ in that particular curriculum, right? So
Yeah.
but I don't think like we trained our student accordingly, right? in
Yeah.
that particular scenario. So we don't have the scenario based, we have the, like, essay type of question. So writing essay, so like, it won't fulfill the, the rationalism in that particular education pattern. So comparing with the Indian curriculum and the curriculum at the outer countries, the Western countries, or maybe the Malaysia or any other countries, right? So we need to be more focused on the industry as well as our healthcare sector, as well as what company wants from us. Okay, so that might be the organization or institute, or might be the, the pharmaceutical industry. So we need to think in that way, how the student can implement their knowledge in application base, rather than, all memorizing the things. So what our student will do, they will do all memorizing the things, right? So what are the types of tablet? Okay, what is the meaning of tablet? What is the capsule? What are the different, the shapes of capsule, or the size of capsule, or something like that. But we don't have the scenario based question. Say suppose like some incidents happen in clinical setup. Say suppose the patient admitted to the hospital with this particular sign and symptoms, and then the
Yeah.
doctors initiated this type of treatment. Then after some time the patient had this type of sign and symptoms. So why this happened? So let them
That
explore.
practical questions are there.
Yes sir. So like, the application base again, coming to the tablet, what are the tablet factors influencing the rate of absorption or something like that. So instead of giving that particular question, we can frame a question in scenario based. So scenario based means like, in industry these incidents happen, and then what are the different, the factors that influence the production of that particular tablet in that particular industry. Okay, so in that way, we are helping the student to think critically. So in that way we are brainstorming them, we are getting the initiative of thought process. So everyone will think accordingly, and then they will come up with the different answer. The some may have the similarity in the answer, the points, but some may have the different, factors. So it's like problem based learning. So comparing with the Indian setup and this one, we have only in Indian curriculum is mainly theory and practical, right? But outside we have many things like case-based learning, problem-based learning, how to assess the student
Yeah.
clinical particular clinical knowledge. So clinical knowledge, and then how we can assess their all aspects of theory as well as practical at one platform. And for that we can use many assessment tool. So assessment tool, how we can use assessment tool will be helpful for MCQ, but when it comes for the practical, so practical we cannot assess. So I know about virtual experiment and everything, right? But some experiments cannot do virtually. So there is a limitation in that way also, right? So we need to think in that aspect. So theory is possible, but I don't believe like, we can also go for the practical. So that practical aspect is
Yeah.
very difficult sometimes to assess. So
Thank you.
that is my answer for your question. Yeah.
Yeah. Thank you, Dr. Praveen, for your wonderful sessions
Thank you,
and
sir. Thank you.
sparing your valuable time.
Thank you. Thank you so much.
Yeah.
If you have any question, yeah, please ask me.
Any question, Dr. Malpuje?
No, sir. There is no question now.
Yeah, proceed further.
So I request, yeah, so I request Bhavsar ma'am to proceed for the vote of thanks.
Thank you, sir, for the wonderful session and very nice information you have shared with us.
Thank you.
It's my privilege to have been asked to propose a vote of thanks on this occasion. Let me first of all, start my giving glory to the Almighty God for making this today's webinar resounding success. I, on the behalf of Matushri College of Pharmacy and the entire fraternity of management, Here altogether extend a very heartfelt gratitude to our special guest speaker, Dr. Praveen Ingle sir, for giving such an excellent and informative session and also making this webinar very meaningful and interesting. I also thank to management MCOP for providing excellent facilities for successful conduction of this webinar. I also wish to express my gratitude to our principal, Dr. Talele sir, for his continuous encouragement, motivation, and guidance for making this program successful. I also thank Mr. Prashant Vivare sir, coordinator of this webinar, Dr. Malpure sir, Mr. Sachin Kapse sir, for their continuous efforts and their valuable contribution towards the program. I also thank all the participants, principal of all the various pharmacy colleges, students, academicians across the globe for peacefully attending this session. Once again, I thank you all for your presence. With prior permission from principal sir,
Yeah, madam.
I would like to end the session.
Okay, thank you. Thank you so
Thank
much.
you very much.
Thank you.
Yeah.
Thank you all.
Thank you, sir. Thank you, Talele sir, and your team members for the efforts to organize this international webinar.